Hello, everyone. I'm Richard Ayub, Project Angel Food Executive Director. Hello, donors, volunteers, members of the press, and staff. At Project Angel Food, we are at the dawn of a new era. For the first time ever, the state of California is funding Project Angel Food for a pilot program to show that our healthy meals can indeed bring down healthcare costs. We have 5 co-pilots in this pilot. They are Project Open Hand in San Francisco, Mama's Kitchen in San Diego, Health Trust in Santa Clara County, and Ceres Community Project and Food for Thought in Sonoma County. California is the first state in the country to fund a program of this kind. We will be providing breakfast, lunch, and dinner to Medi-Cal patients with congestive heart failure. And trust me, that diet is very strict. Someone with congestive heart failure can only have 2 grams of sodium a day. This is what 2 grams of sodium looks like. And sodium is in virtually everything we eat. For instance, celery has 32 milligrams of sodium. And can you imagine how much sodium is in this can of Campbell's soup? It's actually the maximum amount of sodium that someone with congestive heart failure can have in one day. So we believe that, and the state agrees, that this diet, as the patients get out of the hospital, will actually keep them in their home longer, will keep them healthier longer, and will save the state millions of dollars. In fact, if someone stays out of the hospital just one day, that will save the state enough to pay for 3 months of meals. So that's an amazing return on your investment. And as part of this program is medical nutrition therapy that we're providing. What that means is each client is going to get extra special attention from our registered dietitians. We'd like to thank Senator Ben Allen, Assembly Member Blanca Rubio, Assembly Member Richard Bloom, and also Senator Holly Mitchell, whose representative just arrived. So thank you very much. We also have some special guests here, including our colleague from San Diego, Mama's Kitchen Executive Director Alberto Cortez. And a special thanks to our partner, our startup partner in this, LA Care, and CEO John Backus, who shares our vision. At Project Angel Food, we see a future. We see a future where doctors won't just prescribe medicine, but they'll prescribe food, because food is medicine. And now I'd like to invite Assemblymember Blanca Rubio to the podium.
I'm Assemblywoman Blanca Rubio. I represent the 48th Assembly District in the East San Gabriel Valley, but also the Chair of Human Services at the state capitol. It is an honor to support such a project like this. Thank you to Project Angel for being granted, or actually I'm here because I'm honored to celebrate with Project Angel Food on this groundbreaking research, I call it. I think that the data that will be collected from this program will help us in the state legislature really develop more programs like this. It is critical that we not only help the citizens of California, but also that we get ahead of the curve. I feel like at the state capitol, we're chasing our tail most of the time, trying to help folks after the fact. Project Angel Food, through this program, will help us get the data available so that we can do preventative care and intervene early so that we can help the whole state in the Medi-Cal recipients be healthier and have more success, and at the end of the day help us save some money for the state so that we can use it for other needed programs. So thank you again for having me here. Thank you to Richard again for inviting me to Project Angel Food for their commitment to our residents, and thank you, and I hope that the data collected through this project will serve the residents of California. Thank you.
Thank you, Assemblywoman Rubio. We appreciate it. Now I'd like to introduce Senator Ben Allen.
Well, thank you, everybody. It is indeed a bright, sunshining day, and we're just so excited to be here to celebrate with Richard and everybody from Project Angel Food. I just want to say, if you haven't had the opportunity to tour this extraordinary place, I'm excited that you're going to get a chance to take a look at it today. We're going to be talking about one very particular grant, one particular innovative program that we're celebrating today. But part of what made Project Angel Food such a perfect recipient for this grant was the extraordinary work that it does every single day, providing nutritious meals for so many folks who are underserved, who lack resources, who are struggling through all of the pain and discomfort and financial challenge associated with medical conditions and with poverty. And we've got so many people here whose lives are saved by Project Angel Food every single day. They come in here, there's a wonderful social atmosphere for people to eat collectively, but they also go out and they deliver meals to folks who may be on their own, and they come down, they sit with them, they give them a smile, they give them a nice meal, and it really can make the difference between for quality of life for so many people who live in this area. I'm particularly grateful because I happen to be the senator who represents this area. My district goes from Hollywood all the way west to Santa Monica and down to the coastal South Bay. But I know firsthand what extraordinary work Project Angel Food is doing, and that's why I'm so excited that they've gotten one of these grants that we've been able to help to secure. This congestive heart failure pilot program is going to be so exciting. It really is an opportunity for us to pilot a new approach to CHF. 1 in 3 Californians have some form of cardiovascular disease, and we're trying to get our heads around congestive heart failure, how we can treat it, how we can help residents and citizens who have it. Here's how the pilot program works. It's going to be a vital component of LA's response to congestive heart failure. Through a 12-week program, folks will receive delicious, personally tailored meals that will improve their quality of life. And yes, they'll be low sodium. That would be difficult for me because I put salt on my salt. But so I'm definitely gonna. My heart goes out to them for so many different reasons. But it's a great program that's gonna make sure that we meet their needs while also providing them with the support they need. And there's a whole series of wraparound services associated. And ultimately, what's great about this program is that participants are directed to community-based resources that then help them stay on track and empower them to then take control over their own nutrition and their own lives as they learn about their condition and how to treat it. So there's an empowerment aspect to this that's exciting and so important as well. So I'm really honored to be here to celebrate this incredible program. We just played a very small role in helping to secure the funding to make this happen. But ultimately, it's all about us coming together and supporting programs like this to make our community healthier. And I just want to thank everybody from Richard and all the staff who work so hard every single day making a difference in the lives of people in this area. So thank you very much. Thank you.
Thank you, Senator Allen. And now we'd like to introduce Assembly Member Richard Bloom.
Thank you, Richard, and good morning, everyone. It is truly an honor for me to be here at the request of Richard Ayub, who is a leader in our community, leading this great organization. Project Angel Food is central to so many things when it comes to the very difficult circumstances we find ourselves in when as related to hunger and food insecurity. I think it's worth noting that 1 in 8 Californians struggle with food insecurity. 4.9 million are not, and this is Californians, 4.9 million Californians are not sure where their next meal is going to come from, and that includes 1.9 million children across the state. 24.2% of Californians are obese, and 46% are pre-diabetic or have yet to be diagnosed because they haven't been able to get in to see a doctor and get that diagnosis. And into this breach, places like Project Angel Food, like Mama's Kitchen, step in and provide healthy, nutritious meals. In the case of Project Angel Food, since 1989, they've been operating here. They're now providing 500,000 meals a year. Is that right? 500,000 meals a year. It's this service to the community that led me last year to name Project Angel Food our 2017 Nonprofit of the Year for Assembly District 50. And we were very happy to do that. The organization is very deserving. Let's talk a little bit about congestive heart failure, because many of you here have probably heard that term, but don't know exactly what it means. Congestive heart failure typically relates to a weakening of the heart. It could be a result of heart valve. It could be a result of the aging process. But congestive heart failure, if untreated, leads to death. So it's very important to treat it. If you are retaining too much liquid, then congestive heart failure gets worse. That's why it's so important to reduce sodium. That's why it's so important to have a proper diet when you've been diagnosed with congestive heart failure. This all ties in to larger health issues that we have, not just in the state of California, but across the country. As I mentioned, obesity rates are skyrocketing. They're directly related to heart disease, which is what leads to congestive heart failure. That's why I've championed for the last several years the Healthy California Fund, a $2 billion fund that would, if implemented, provide relief to organizations, provide funds to organizations like Project Angel Food, like Mama's Kitchen, to provide even more services, because this is a pilot project, folks. This is going to expire, the funding will last for 3 years. So in 3 years, we need to figure out where to go from here. It's also only addressing a small number of people compared to the overall need. So we need to figure out where the funding is going to come from. We know we can't count on the federal government right now, but we need to find out where in the state funding can come from. That's what the Healthy California Fund will do. I'm very, very pleased to be here, and I invite you all, if you haven't had a tour of this facility, come see what they're doing here, the important work they're doing to serve the Californians who are very much in need. Thank you.
Thank you, Assemblymember Bloom. And now I'd like to introduce Hannah Cho, who's with Senator Holly Mitchell's office.
Hi, good morning, everybody. I'm here to represent Senator Mitchell. She sends her regards. I even tried to get a hologram of her in, but unlike the success with Tupac, you guys got me instead. So I just want to say congratulations and warm welcomes from the Senator, and we are really proud to be part of this event and this kind of whole pilot program. Senator Mitchell is a champion of social justice, and her and Senator Ricardo Lara have a equity and justice bill package they do every session. And being part of a program that serves others and is kind of the forefront of leading that kind of belief system and the value system that the Senator has towards equity and justice for all is just really exciting. So on behalf of Senator Mitchell and our district office, we'd like to present Project Angel Food with the certificate. And congratulations, Richard, and everybody who works so hard every day.
Thank you.
Oh, there we go.
There it is. Thank you very much. Thank you very much. And now I'd like to introduce the CEO of LA Care, John Backus.
Thank you, Richard, and thank you to our friends from Sacramento who made this happen. And if you need more ideas, see me afterwards. We're very happy to participate in this program and provide not only financial assistance, but I understand 6 of our staff members are here today volunteering in the kitchen.
Yes.
And so our staff also goes out and works in the community. The reason this is so important is that it's a small step in beginning to identify and recognize that food is very important in healthcare, and we should be considering ways that we provide food just as we provide medicine, because a nutritional diet will spare us from unnecessary expenses, including medications, if people are eating the right foods at the right place at the right time. All of this is a result of the large number of people we have living in poverty. We take care of 2.2 million lives at LA Care, all who live here in Los Angeles County. There's another million or so who are also living and working in poverty. So there are about 35% of our county is in that condition. At LA Care, we consider poverty a health epidemic, and we must be addressing it in other ways merely than paying for the bills of people on Medi-Cal when they go to the hospital or see the doctor. So we have to identify these things. Think about it. Somebody on Medi-Cal cannot earn more than $16,400 as an individual or $33,900 as a family of four. It's impossible for those families and individuals to cover all their needs on that amount of income without some help or assistance. And getting them out of poverty would be our first goal, but in the meantime, what can we do to give them the access to the best things that will improve their quality of life so they can move on? So we're delighted to be here, Richard, and delighted to share the podium with our elected representatives from Sacramento. And this is only the beginning. I hope we're back here in 3 years when this is over to talk about that we've had legislation that begins to include food as a covered benefit. Thank you.
Thank you, John. We'd like to now introduce Mama's Kitchen Executive Director, Alberto Cortez.
Buenos dias. At Mama's Kitchen, we believe that everyone's entitled to the basic necessity of life, nutritious food. We're really excited to be a part of this project, and for many reasons. It serves as a perfect example of collaboration among 6 nonprofit organizations throughout the state of California. An example of collaboration with the state of California, with the state government, as well as collaboration with healthcare providers. And all of these pieces are critical to making this project happen. But the most exciting part of this project is really making a difference in the lives of Californians that are traditionally and chronically vulnerable to hunger and illness, and to make a difference in a way that lifts everybody. So I'm excited to be here. I'm grateful for the opportunity to share this celebration, and I thank you.
Thank you, Alberto. And in a moment, we'll all go inside and do some taste tests of the delicious 2 grams of sodium meals for congestive heart failure patients. But right now, I would like to do a special ribbon cutting ceremony. LA Care has provided us with our first refrigerated van that will be used to deliver the meals for the congestive heart failure clients. So let's step over here.
All right, we're going to open the door here. There you go.
Oh, wow.
There you go.
Yes.
You don't change.
Oh, you look amazing. I love that. Sweet.
Ready?
It works.
Yeah. Absolutely. And did you see the change?
It helps in some way to prevent that.
Okay, so we're invited inside to do some taste testing. You were camping. Start a new era because
I start to go like this.
Right.
Mine, anyway.
and you know, people are very quick to turn around.
Okay.
All right. Thank you. Oh. But you'll be amazed at how it tastes without the sauce. We did taste test it. So I think we're sick. The meals have to look tasty because they're nauseous and going. And so this, we really try and make it as attractive as possible. This is Chef Angel.
Hi, Angel.
That's
a perfect name.
Thank you. Yes, thank you. Bye.
That's totally true.
That's true.
That's totally true.
I'd be happy to cut you a piece of chicken.
Thank you. That's very kind of you. Very great. Let me show you why I got
Richard, I think you should start using this. It's empty.
We should use
It costs you so much money.
Exactly. And it's spotless. We take a lot of pride in this kitchen and we clean it. We're always ready for a health inspection.